Hope you're doing well today. Today we are going into chapter 19. This is clients with nutritional or metabolic concerns as a part of a three-part series. So here we go. So the objectives with this chapter are able to delineate the scope of practice of the personal trainer working with people who have nutritional or metabolic concerns, and be able to discuss the appropriate exercise prescription program design for individuals who are obese or overweight, or who have hyperlipidemia or diabetes or another eating disorder. Be able to describe general nutritional guidelines for individuals with these nutritional or metabolic concerns, and discuss lifestyle change strategies with diet, exercise, and behavioral changes that will improve the health status of people with these concerns. With the changes in society and lifestyle habits, there has been a significant increase in the prevalence of obesity, hyperlipidemia, which are high levels of lipids or fats in the blood, diabetes, as well as disordered eating patterns and eating disorders. As a result, personal trainers are more likely to encounter clients who have one or more of these conditions. In order to ensure the safety and effectiveness of their training programs, personal trainers should perform screening and assessment before working with these clients. Screening for clients with obesity, hyperlipidemia, diabetes, disordered eating, or eating disorders typically involves gathering relevant health information, assessing risk factors, and understanding the client's medical history. Here are some key steps to take during the screening process. Of course, the health questionnaires that we have covered at the beginning of the term really covering medical history, previous injuries, their current medications, and any known health conditions you're looking for information that will help identify potential risk or contraindications to certain exercises or training techniques. You should conduct a thorough physical assessment to evaluate the client's current fitness level, their body composition, and any physical limitations or imbalances. This can include measurements such as body mass index or waist circumference, blood pressure, and range of motion tests. For clients with pre-existing medical conditions like diabetes or cardiovascular disease, it is essential to obtain medical clearance from their healthcare provider. This clearance will ensure that the client is medically fit to engage in physical exercise and that any necessary precautions or modifications are taken into account. If a client has a complex medical condition or requires specialized care, personal trainers should work in collaboration with their healthcare professionals, such as physicians, registered dietitians, or therapists, to develop an appropriate and safe exercise program. You always want to maintain open and ongoing communication with the client to understand their goals, challenges, and preferences. Additionally, provide support and encouragement to ensure adherence to the program while addressing any concerns or setbacks that may arise. By performing these screenings and assessments, personal trainers can tailor exercise programs to meet the specific needs and goals of their clients. It's important to prioritize the client's safety, provide appropriate modifications, and refer them to specialized professionals when necessary. Exercise program design and execution, as well as lifestyle change support, are important components of a personal trainer's role. It is worth noting that their scope of practice can vary depending on the jurisdiction and their specific certifications and qualifications. In many cases, personal trainers work within their defined scope to ensure the safety and well-being of their clients. However, it's important to recognize that personal trainers should not exceed their professional boundaries and provide services outside their expertise. Personal trainers typically should focus on the following areas of exercise program design and execution. Personal trainers create customized exercise programs based on the client's goals, fitness level, and any specific needs or limitations. They guide clients through proper exercise techniques and provide supervision during workouts to ensure safety and maximize effectiveness. Personal trainers conduct assessments to evaluate the client's current fitness level, body composition, flexibility, strength, and cardiovascular endurance. These assessments help the trainers track progress and tailor the exercise program accordingly. Personal trainers work with clients to establish realistic goals and develop a plan to achieve them. They regularly monitor and evaluate progress, making adjustments to the program as needed to ensure continued progress. Personal trainers often provide guidance and support beyond exercise, helping clients make positive lifestyle changes. This may include recommendations for nutrition, sleep, stress management, and other factors that impact overall well-being. Personal trainers serve as motivators and provide accountability to help clients stay on track with their fitness goals. They offer encouragement, support, and education to maintain client engagement and adherence to the program. It's important to note that personal trainers are not qualified to diagnose or treat medical conditions. They should not provide nutritional advice or recommend dietary supplements unless they have appropriate certifications or qualifications. If a client presents with complex medical conditions or requires specialized care, personal trainers should refer them to appropriate healthcare professionals. Ultimately, personal trainers play a crucial role in helping individuals improve their physical fitness and adopt healthier lifestyles and achieve their fitness goals. They work in collaboration with clients to provide guidance, motivation, support, while also recognizing their professional boundaries and referring clients to the appropriate professionals when necessary. Key point is personal trainers should not attempt to diagnose or prescribe care for medical conditions, as this falls outside their scope of practice. It is important for personal trainers to recognize their limitations and refer clients to appropriate healthcare professionals when necessary. When working with clients who have medical conditions or specific health concerns, personal trainers should stay in their lane of area expertise and focus on exercise program design, execution, and lifestyle change support. They can provide guidance on general exercise recommendations and modifications that may be beneficial for clients with certain conditions, but they should not go beyond their knowledge and expertise. If a client presents with a medical condition that requires specialized care, or if the personal trainer feels that the client's needs exceed their expertise, it is crucial to refer the client to an appropriate healthcare professional. This could include physicians, registered dietitians, physical therapists, or any other specialists who can provide the necessary expertise and guidance. By staying within your scope of practice and collaborating with healthcare professionals, you can ensure the safety and well-being of your clients while maximizing the effectiveness of your exercise programs. Overweight and obesity are indeed significant public health problems that have reached epidemic proportions globally. They pose numerous health risks and have a substantial impact on individuals, communities, and healthcare systems. Here are some key points highlighting the significance of overweight and obesity as a public concern. Its prevalence. The prevalence of overweight and obesity has been steadily increasing worldwide over the past few decades. This trend is observed across all age groups and socioeconomic backgrounds, affecting both developed and developing countries. Overweight and obesity are associated with a higher risk of developing several chronic conditions, including type 2 diabetes, cardiovascular diseases such as heart disease and stroke, certain types of cancer, respiratory problems, musculoskeletal disorders, and mental health issues. The economic burden of overweight and obesity is substantial. The costs associated with medical treatment, hospitalizations, pharmaceuticals, and productivity losses due to obesity-related illnesses places a significant strain on healthcare systems and economies. Overweight and obesity can negatively affect an individual's quality of life. It can lead to physical discomfort, reduced mobility, body image concerns, low self-esteem, social stigma, and discrimination. The rise in childhood obesity is particularly concerning as it increases the risk of obesity and associated health problems in childhood and adulthood. Childhood obesity can have long-term effects on physical and psychological health, education, and overall well-being. Addressing overweight and obesity requires a multifaceted approach involving individuals, communities, governments, healthcare providers, and various sectors. Strategies may include promoting healthy eating habits, regular physical activity, access to nutritious foods, education on portion control, policies to reduce the consumption of unhealthy foods and beverages, and creating supportive environments for healthy lifestyles. Public health initiatives, community programs, and individual efforts aimed at preventing and managing overweight and obesity are essential for reducing the burden of these conditions and improving overall health and well-being. Morbidity refers to the state of being diseased or having a specific health condition. It is a term used to describe the prevalence and impact of illnesses or diseases within a population. Morbidity encompasses both acute and chronic conditions ranging from mild ailments to severe diseases. Overweight and obesity are terms used to describe an excessive or abnormal accumulation of body fat that may have a negative effect on health. While they are related, they have distinct definitions based on different measurements and criteria. Here are the definitions and important differences between the two. Overweight is generally defined as having a higher body weight in relation to height than what is considered healthy. It indicates an excess amount of body weight, which can be attributed to factors such as muscle mass, bone density, and body fat. BMI, or body mass index, is commonly used to assess overweight and obesity. An individual is classified as overweight when their BMI is between 25 and 29.9 kilograms per meter squared. Obesity, on the other hand, refers to a more severe degree of excess body weight and involves a higher proportion of body fat that may adversely affect health. It is associated with an increased risk of developing various health conditions. Similarly, BMI is often used to assess obesity. An individual is classified as obese when their BMI is 30 kilograms per meter squared or higher. Key differences between the two: overweight is considered a milder condition, whereas obesity is a more severe form of excess body weight. While both overweight and obesity are associated with health risks, the risks tend to be higher for those classified as obese. Obesity is linked to a greater likelihood of developing chronic conditions such as cardiovascular diseases, type 2 diabetes, certain cancers, and musculoskeletal disorders. The recommended approaches for addressing overweight and obesity may vary. Overweight individuals may benefit from lifestyle modifications such as healthy eating habits and regular physical activity to achieve a healthier weight. For individuals with obesity, more comprehensive interventions may be necessary, including dietary changes, increased physical activity, behavioral counseling, and in some cases, medical management. It's important to know that while BMI is commonly used, it has limitations. It does not take into account individual variations in body composition, muscle mass, or distribution of fat. Other factors such as waist circumference, waist to hip ratio, and assessment of body fat percentage may provide additional information when evaluating an individual's health status. Overweight and obesity are complex conditions influenced by a combination of genetic, environmental, behavioral, and socioeconomic factors. Understanding the causes and correlates of overweight and obesity can help inform prevention and intervention strategies. Genetic factors play a role in determining an individual's susceptibility to overweight and obesity. Some people may have a genetic predisposition that affects metabolism, fat storage, and appetite regulation, making it easier for them to gain weight. Environmental factors. Caloric intake, so consuming excess calories from high-calorie, energy-dense foods and beverages contributes to weight gain. Factors such as the availability, accessibility, and affordability of unhealthy food options and large portion sizes can influence caloric intake. Sedentary behaviors such as prolonged sitting, low physical activity levels, and high screen time of television, computers, and smartphones contributes to weight gain by inducing or reducing energy expenditure. Features of the built environment, such as a lack of safe and accessible spaces for physical activity, limited access to fresh and nutritious foods, creating food deserts, and reliance on automobiles instead of walking or biking can contribute to weight gain. Aggressive marketing and advertising of unhealthy foods and beverages, particularly targeting children, can influence dietary choices and contribute to unhealthy weight gain. If you look at the behavioral factors, poor dietary habits such as excessive consumption of sugary drinks, processed foods, high-fat foods, and low intake of fruits and vegetables are associated with overweight and obesity. Insufficient physical activity and low levels of exercise contribute to weight gain. Lack of regular exercise and sedentary behaviors are significant risk factors. Inadequate sleep and poor sleep quality have been associated with weight gain and an increased risk of overweight and obesity. Socioeconomic status, or SES. A lower socioeconomic status is often associated with a higher prevalence of overweight and obesity. Factors such as limited access to affordable healthy foods, limited opportunities for physical activity, and higher levels of stress can contribute to this association. Lower educational attainment is linked to a higher risk of overweight and obesity. Limited knowledge and awareness of healthy lifestyle behaviors may contribute to less healthy choices. It is important to note that these factors interact and influence each other, making it a complex issue to address. Comprehensive approaches that might consider multiple factors are needed to prevent and manage overweight and obesity, including education, promotion of healthy lifestyles, policy changes, and creating supportive environments that facilitate healthy choices. Fat distribution refers to the pattern and location of body fat in an individual's body. It can vary among individuals and may have implications for health and disease risk. Two common patterns of fat distribution are commonly referred to as android, which is central obesity, and gynoid, which is peripheral obesity. Android, or central obesity, is characterized by the accumulation of fat primarily in the abdominal area, around the waist and abdomen. This results in an apple-shaped body appearance. Oftentimes, men have a tendency to be a little bit more in this area. The health implications associated to central obesity is associated with a higher risk of developing chronic diseases, including cardiovascular disease, type 2 diabetes, hypertension, dyslipidemia, and metabolic syndrome. The excess or visceral fat, which is fat surrounding the internal organs, is believed to be more metabolically active and may release inflammatory substances that contribute to these health risks. Gynoid, on the other hand, or peripheral obesity, refers to the accumulation of fat predominantly in the hips, thighs, and buttocks, resulting in a pear-shaped body appearance. The health implications compared to central obesity, gynoid obesity is generally considered to be less metabolically detrimental. However, it may be still associated with a higher risk of lower body joint problems such as osteoarthritis and certain reproductive health issues. It is important to note that fat distribution patterns can vary among individuals and may not fit precisely into the defined categories of android or gynoid obesity. Genetic factors, hormones, age, gender, and lifestyle factors can influence fat distribution. Monitoring body fat distribution can provide insights into individuals' health risks, but it is important to consider other factors such as overall body composition, including muscle mass and bone density. Maintaining a healthy body weight, engaging in regular physical activity, and adopting a balanced diet are generally recommended to promote overall health and manage fat distribution. Measuring abdominal fat can provide valuable information about a person's health and the risk of developing certain conditions associated with central obesity. While there are various methods to assess abdominal fat, here are a few common approaches. Waist circumference is a simple and widely used method to measure abdominal fat. It involves measuring the circumference of the waist at a specific point, usually above the navel or the belly button. The measurement is taken with a flexible tape measure while the person stands with their abdomen relaxed. Increased waist circumference is associated with a higher risk of obesity-related health conditions such as cardiovascular diseases and type 2 diabetes. Specific cutoff values for increased risk may vary based on factors such as gender, ethnicity, and population characteristics. The waist-hip ratio is another method used to assess abdominal fat distribution. It compares the waist circumference and the circumference of the hips. The waist circumference is divided by the hip circumference to obtain the ratio. A higher waist to hip ratio indicates a greater amount of abdominal fat, and is associated with an increased risk of obesity-related health conditions. There are advanced imaging techniques such as computed tomography or CT scans and magnetic resonance imaging or MRI that can provide detailed information about the distribution and amount of abdominal fat. These methods offer a more precise measurement of visceral fat, which is the fat that surrounds the internal organs and is associated with health risks. However, these techniques are more expensive and generally reserved for research or clinical settings. It's important to note that measuring abdominal fat alone may not provide a comprehensive assessment of overall health. Other factors such as BMI, body composition, and individual health markers should be considered in conjunction with abdominal fat measurements. And you can see here, men whose waist circumference exceeds 40 inches or more, or women whose waist circumference exceeds 35 inches tend to be at a higher risk for developing type 2 diabetes, dyslipidemia, hypertension, and CVD. And if they have a BMI between 25 and 34.9 kilograms meters squared, they are considered to be at a high risk as well. Exercise plays a crucial role in weight reduction programs for obesity. It offers numerous benefits that can contribute a successful weight management and overall health. Here are some key benefits of exercise in a weight reduction program for obesity. Engaging in regular physical activity helps burn calories, which is essential for creating an energy deficit and promoting weight loss. Exercise increases energy expenditure, particularly when combined with moderate to high intensity activities. Exercise, especially aerobic and resistance training, can aid in reducing body fat and improving body composition. It helps preserve lean muscle mass and while targeting fat stores, leading to a healthier ratio of lean tissue to fat. Exercise can boost the metabolic rate, both during exercise and in the post-exercise period. This increased metabolism can facilitate weight loss by burning additional calories even when at rest. Regular exercise has been shown to influence appetite regulation. It can help reduce hunger, control cravings, and improve satiety, which can be beneficial for managing food intake and reducing the risk of overeating. Exercise improves cardiovascular fitness and reduces the risk of heart disease, which is commonly associated with obesity. It enhances heart and lung function, lowers blood pressure, improves blood lipid profile, and enhances overall cardiovascular health. Regular exercise can improve insulin sensitivity, meaning the body becomes more efficient at using insulin to regulate blood sugar levels. This can help prevent or manage conditions like type 2 diabetes, which are commonly linked to obesity. Exercise has positive effects on mental health and well-being. It can reduce stress, anxiety, and symptoms of depression, often associated with obesity. Exercise also promotes the release of endorphins, which are natural mood boosters. Incorporating exercise into a weight reduction program can contribute to long-term weight maintenance. Regular physical activity helps prevent weight regain and supports the adoption of healthy lifestyle habits. It's important to note that combining exercise with a balanced and nutritious diet is typically more effective for weight reduction than exercise alone. Dietary modification is a key component of weight control and plays a significant role in achieving and maintaining a healthy weight. Personal trainers should refer these clients to a registered dietitian. Here are some guidelines to dietary modification. Balancing caloric intake and expenditure is fundamental for weight control. Consuming fewer calories than the body needs leads to weight loss, while consuming more calories leads to weight gain. Aiming for a moderate calorie deficit, typically of 500 to 1,000 calories per day, can result in sustainable weight loss. Controlling portion sizes helps manage caloric intake. It involves being mindful of the amount of food consumed and practicing portion awareness. Strategies such as using smaller plates, measuring food portions, and practicing mindful eating can contribute to portion control. A balanced and nutritious diet provides essential nutrients while supporting weight control. It typically includes a variety of whole foods such as fruits, vegetables, whole grains, lean proteins, and healthy fats. Emphasizing nutrient-dense foods and minimizing processed and high-calorie foods can help meet nutritional needs while managing caloric intake. The distribution of macronutrients of carbohydrates, proteins, and fats in the diet can influence satiety, energy levels, and weight control. There is no one-size-fits-all approach, but some strategies include consuming adequate protein to promote satiety, prioritizing complex carbohydrates over refined carbohydrates, and including healthy fats in moderation. There is no definitive evidence on the optimal number of meals or specific meal timing for weight control purposes. Individual preferences and adherence play a role. Some people find it helpful to spread meals and snacks throughout the day to prevent excessive hunger, while others prefer intermittent fasting or time-restricted eating patterns. It's important to find an eating pattern that suits an individual's lifestyle and can be sustained in the long term. Practicing mindful eating involves paying attention to internal hunger and fullness cues, eating slowly and savoring food. It promotes a better connection with the body's natural hunger and satiety signals, helping prevent overeating and promoting a healthier relationship with food. Staying adequately hydrated is important for overall health and weight management. Drinking water instead of sugary beverages can reduce calorie intake and promote hydration without adding unnecessary calories. Dietary modifications should be personalized to an individual's needs, preferences, and health conditions. Consulting with a registered dietitian or nutritionist can provide tailored guidance, support, and education on making sustainable dietary changes for weight management. It's worth noting that sustainable dietary modification involves long-term lifestyle changes rather than short-term restrictive diets. Building healthy habits, incorporating a variety of nutritious food, and finding an eating pattern that can be maintained over time are essential for successful weight management and overall well-being. Dietary prescription or counseling is beyond the personal trainer's scope of practice. Instead, the personal trainers can offer nutrition education and discuss the concept of fueling around their workouts. There are many dietary approaches that clients can follow to achieve weight loss. Achieve sustainable weight loss, it's important to make sure to take dietary approaches. Creating a caloric deficit is essential for weight loss. It can be achieved by reducing overall caloric intake through portion control, mindful eating, and making healthier food choices. But the idea is to try to reduce body weight by 7 to 10% over 6 months. And that's an appropriate initial goal. And then you can set new goals. Sustainable weight loss is a gradual process, and individual preferences, health considerations, and adherence are important factors. It's recommended to consult with a healthcare professional such as registered dietitians, certified personal trainers to receive personalized guidance and support in developing a dietary and exercise plan suitable for an individual's needs and goals. And that is all that I have for you today. We'll be talking about part 2 in our next discussion. I look forward to talking to you again. Have a great day.